Dr. Zachary Binder. I'm PEM ultrasound faculty at UMass Memorial Medical Center, and today I'm going to be speaking about tricuspid regurgitant jet velocity assessments. Our goals and objectives for this session will be the following: to define tricuspid regurgitant jet velocity, which we will abbreviate as TJRV. We'll discuss the clinical implications of tricuspid regurgitant jet velocity measurements. We're going to discuss image acquisition, followed by measurement acquisition. Tricuspid regurgitant jet velocity is defined as the measured backflow of blood from the right ventricle into the right atria during systole. A TJRV measurement of less than 2.5 meters per second is considered physiologic, whereas a measurement over 2.5 meters per second is considered elevated or pathologic. I want to take a moment to discuss the clinical implications of the TJRV measurement. Pulmonary hypertension has high morbidity and mortality. The diagnosis of pulmonary hypertension is not currently possible in the pediatric emergency department setting. Tricuspid regurgitant jet velocities are used by cardiologists to derive a pulmonary artery pressure. The TJRV acts as a surrogate for the right ventricular pressure, which then acts as a surrogate for the pulmonary artery pressure. The ability to assess for pulmonary hypertension in the emergency department setting could assist in the management of multiple potential presentations, including syncope, pulmonary embolism, asthma, or in a sickle cell crisis, as well as the possible diagnosis of idiopathic pulmonary hypertension. When assessing for tricuspid regurgitant jet velocities, we will be using the phased array transducer. This enables us to acquire imaging windows between the patient's ribs. We're going to be choosing the cardiac settings, and there are no adequate alternative transducers for this study. As depicted in this image, we are going to want to position our patient in the left lateral decubitus position. As depicted in this image, when we are obtaining these images, we are going to be placing the probe on the patient's left chest in line with the patient's left nipple. There are four main steps to obtaining a tricuspid regurgitant jet velocity. Step 1 is to obtain an apical four-chamber view. Step 2 is to apply color. Step 3 is to apply continuous wave Doppler. And finally, we will obtain our measurement. We begin the acquisition of a tricuspid regurgitant jet velocity by obtaining a classic apical four-chamber view, as depicted here. I've labeled the left ventricle, left atria, and right atria. And as you can see, the left side of the heart will be depicted screen right, whereas the right side of the heart will be depicted screen left. We want to make sure that we have always properly oriented ourselves. Two ways to do this are to remind ourselves that the right ventricular apex does not generally reach the true apex of the heart. Secondly, we remember that the tricuspid valve septal leaflets are generally closer to the cardiac apex than the corresponding mitral valve leaflets. In obtaining our optimal apical four-chamber view, we want to assure ourselves that we have the ultrasound beam parallel to the intraventricular septum and perpendicular to the tricuspid valve. We've now applied color to our apical four-chamber view. When adjusting our color box, we want to do a number of things, including minimizing the width of the color box to include just the tricuspid valve orifice. We want to make sure that the color box extends past the tricuspid valve leaflet tips. And we want to make sure that the color box extends to the back wall of the right atrium. In this video clip, you are seeing the sonographer first apply a color box, adjust the location of the color box, and then adjust the size of the color box accordingly. The next step in obtaining a tricuspid regurgitant jet velocity measurement after we have applied color is to now apply continuous wave Doppler. I want to first orient you to the image you will see when applying continuous wave Doppler to your ultrasound image. So on the top of the screen, you are seeing an image of a classic apical 4-chamber view. You have also seen a color box applied to the apical 4-chamber view over the tricuspid valve, as well as a cursor depicting the application of continuous wave Doppler. On the lower part of the screen, you are seeing the continuous wave Doppler waveform. I've labeled the baseline as well as the various velocities. The following is a representation of a continuous wave Doppler waveform. All deflections in the negative direction represent systole, whereas all deflections in the positive direction represent diastole. In this image here, we are seeing 3 complete cardiac cycles depicted. This video clip depicts the application of continuous wave Doppler to our apical 4-chamber view with the color box applied. You see the cursor being placed inside the tricuspid valve. There are a number of features that you will want to adjust once you have obtained your continuous wave Doppler, including adjusting the location of the baseline, the scale to ensure that your entire waveform is visible on your screen, and finally, your gain function. Initially, this image was significantly overgained, and you're seeing the sonographer make the corresponding adjustment. The final step in obtaining a tricuspid regurgitant jet velocity is to make the actual measurement. We do this by placing our cursor at the tip of the largest negative envelope. This point will then correspond to a velocity, as can be seen along the right side of your screen. In this image, the velocity is just over 200 centimeters per second. One potential pitfall that I would like to discuss is the concept of feathering. In the image, you see 2 points depicted, point A and point B. You want to make sure that you are measuring at point A, which is the peak of this largest negative envelope. You don't want to be measuring at point B here, which includes ancillary feathering. In this clip, you will see our sonographer making the TJRV measurement, as we discussed, by placing the cursor at the tip of the most negative envelope. In summary, we have 4 steps to obtaining our tricuspid regurgitant jet velocities. We obtain our apical 4-chamber view. We then apply color, followed by continuous wave Doppler, and finally, we obtain our measurement. The following video will show the sonographer obtaining a tricuspid regurgitant jet velocity measurement. First, we obtain our optimal apical 4-chamber view. We then apply a color box. We adjust the color box. We then apply continuous wave Doppler, placing the cursor right in the center of the tricuspid valve. We then make the corresponding adjustments to our baseline, scale, and gain. And finally, we make our measurement. The following slide has my biographical information as well as my contact email address. Please reach out with any comments, questions, or concerns. I hope you enjoyed this presentation.